Hey there. So today we're going to go over a checklist that my clients use for more successful doctor's appointments so that they leave feeling empowered instead of frustrated, hopeless, just overall bad. Hi, my name is Kayna Cassard, and I've been helping vulva owners and couples recover from the impact of painful intercourse, low arousal, and intimacy issues since 2006. Now, today we're going to explore a checklist that my clients have found really helpful to take with them to doctor's appointments if they're feeling nervous about it, which I'm sure if you're like me or my clients, you probably are. When I was first dealing with pelvic pain treatment, I went into appointments feeling unprepared, not feeling very knowledgeable, not really knowing exactly what to expect or what to share. I was nervous sitting in the waiting room, and I often left feeling really frustrated and hopeless in all that I needed in order to tackle my treatment, which didn't help me want to stick to my treatment plan. So then I got more organized and I took more control over what I could and found that I had much more helpful and empowered appointments with my specialists, which of course was a really key important part to sticking to my treatment plan and making sure that it actually worked. So I put all of this into a checklist and gave it to my clients who have also found it really helpful with their treatment plans. And at the end, I'll tell you how you can get a copy of your own checklist and a handout on how to use it best. So first, let's go over what it is and why it's helpful. So the most important part about your treatment is getting organized. When you can confidently and accurately tell your symptoms to your doctor and your experiences, then you both win. You'll both feel really good about it because you'll be empowered and your doctor will be able to diagnose what's going on for you correctly. Now, sometimes with diagnosing, because I do this myself as a psychotherapist, we have an idea just kind of on the general presentation of what a client is bringing to us. We have a general idea of it could be this diagnosis or this disorder or this syndrome. Could be all of these things. But as I ask more questions, as I hear what the client is sharing, I start to eliminate some of these based on specific symptoms or experiences the client is having. And so this happens with doctor's appointments as well. So you want to be able to make sure that you are going in with an accurate picture of what you've been experiencing. So this is the checklist, and there are 6 parts to it. The first part is more for you than anybody else. This is about setting your intention for the appointment. This helps you lay the foundation for you to feel like you can confidently step into the doctor's office, feeling really good about what you're going to bring and what you're going to get from the appointment. Then you're going to want to identify the most pressing concerns so you know exactly what you and your doctor are talking about. Now, thirdly, you're going to list your symptoms. Of course, it's so helpful. And the symptom list is really important because everyone's symptom expression of pelvic pain experience or diagnoses might actually be different. And so somebody might have pain during intercourse, but it might be different in the sense that it might be painful on the outside of the vulva or on the outside of the vagina and around the vulva, or it might be painful deep inside. And so being able to get very specific about what symptoms you're experiencing will be really helpful. And I give a list in the copy of the checklist that you'll get access to in just a moment. And then you're going to want to provide a brief summary of what you've been through, of your pelvic pain history, of your sexual pain history. And you don't want it to be too lengthy that you spend a lot of time talking about the history, but you also want to give enough to where your doctor can make the most effective diagnosis. So usually what I like to say is an Instagram comments worth, an Instagram post comments worth. So that's about 500 words. And then the 5th thing is that you're going to list all of your questions about your pain and treatment. So this you might collect over time. Actually with all of these, you might start to take notes on your phone when you're out and about, so that maybe if you don't remember, or if you have a sudden flare-up or a sudden pain experience, you might not remember when you get home a few days later if the pain sensation goes away, or if the questions you have pop up and then go away. So it might be helpful to just kind of for the weeks leading up to your appointment, just start to take notes anytime you think about it. And then finally, you're going to have a section that is just the treatment plan. And this is going to be blank until you meet with your doctor. And then when your doctor discusses what they think the diagnosis is and what the treatment plan is, your prescriptions, your PT, the exercises you need, other healthcare providers that might be important for your treatment, you're going to write all of those down, either during the session, or you can record the session and then refer back to the points later on. So you can use this 6-step process, and that will help you get organized with all of the specialists that you're probably having to deal with. And this will really help with reducing overwhelm, remind you of what you need to be doing if you happen to fall off your treatment 5 weeks later, and most importantly, it will help you feel empowered in your treatment process. And that alone has actually been one of the most successful key parts, or one of the key parts of what has created successful treatment for my clients, is that when they feel empowered and organized and they know what they need to be doing and can do it, then that like sense of can do, that self-efficacy, that is a really, really important part of getting better. And it kind of is the difference between those who find success and those who kind of keep on having to deal with the pain. And I don't want that for you. So if you found this to be helpful, you can actually get a copy of your checklist down in the comments. You can also make sure to subscribe so that you keep getting information. Subscribe and hit the notification so that you keep getting access to this information that might actually be the thing that helps you get the kind of intimate life that you desire and deserve. I'll see you around.